Adana Musa, who goes by Parker Musa, is a 46-year-old transgender male of Nigerian descent. For context, Parker uses the pronouns they/them. Parker had been recently taken to Brookside Hospital for same-day cataract surgery. They are now receiving post-op care back at a local medical shelter. You are a community mental health nurse working at the medical shelter. You have not met Parker before, but before you begin your shift, you take a look at their chart. You notice that Parker is listed as having no fixed address, and in their social history, there is no mention of family or other contacts. They have a history of an alcohol use disorder, which they are on a number of medications for, but when you read other nurses' documentation, you see that they have been refusing a lot of them. The night shift nurse comes to give you report. When they get to Parker, the nurse comments that Adana was being difficult and refused their naltrexone. Today, aside from that, no concerns. The nurse quickly moves on to the next patient before you can probe further. Later in the day, you go to Parker's room to administer their morning medications and perform a wellness check. When you knock on the door, Parker responds from inside saying, "I don't want any meds, you can go." You introduce yourself, mentioning your preferred pronouns, role, and care plan, and then ask Parker how they would like to be addressed. After some silence, Parker tells you to come in. When you open the door, you see that Parker's room is quite disorganized. Parker is lying in the bed with her back towards you. You ask Parker how they are doing, and they sigh, "I'm fine." When you try to probe further, Parker quickly changes the subject. You proceed to ask about the surgery, trying to get some information about how Parker's cataracts developed. But Parker doesn't seem interested in talking about it. You notice there are some open cans of beer sitting on the window ledge, presumably empty. You ask Parker if they're experiencing any fatigue, weakness, or stomach pain. Parker looks at the cans and swears under their breath, "Look, it was just one beer. I didn't mean to drink the entire case." You assure Parker that while not ideal, it's normal to relapse, and what's important is their current well-being. Parker seems relieved by your response and sits up to face you. "I was just having a rough night, you know." Parker proceeds to explain that after their surgery, they've just been stuck in their room for the past couple of days. "I'm used to it, so it's whatever, but I don't know. I shouldn't have even had them in my room, but when I saw them, I couldn't help myself." Parker mentions that they've been trying really hard to stay sober, but recently they've been finding it very hard. You acknowledge Parker's feelings and commend them for their effort to stay sober. You ask if anything's happened or changed recently, aside from the surgery, that might have led to them relapsing. They shared that they repeatedly tried going to the hospital, complaining about their blurry vision, but were turned away. They probably just thought I was some drunk or something. It was only when Parker had a minor car accident a month ago, due to their impaired vision, that they were assessed and taken in. "I don't know. I know I have issues, but it just feels like it's one thing after another. You think you're getting better, then all of a sudden you have eye problems. You try to go to the hospital and nothing happens. You try to focus on work, you end up in a car accident. Then somehow he finds out." You ask Parker who they're referring to. Parker sighs. "He was my fiancé. When I first immigrated here, he was so happy to have me. I would help watch his little ones and help around the house, and he would be so grateful. But then..." Parker then shares that after some time in Canada, they were struggling with their identity. "I never felt like all the other girls back home. Before, I couldn't explain it, but when I came here, I felt like I was finding a new person in myself." Parker explains they had hidden these feelings to themselves, but one night, their fiancé tried to pressure them into sex, and Parker let these feelings slip out. Their fiancé was furious, claiming he sponsored Parker to be his wife, and now she was cheating him out of what was his. He started shouting and calling me these horrible names. I just didn't feel safe, so I ran and left. I tried to live on my own, get a job, but every place I applied to told me they were looking for people with Canadian experience and better communication skills. Parker scoffs. I'm not stupid. I know what they meant. With no source of income, Parker found themselves living in their car, getting by with whatever they could find. I didn't know what to do. I had no one to help me, and that's how I ended up here. Parker finishes. When I moved to Canada, I never thought I would turn out like this. Parker goes quiet and stares off at a wall for a while. You sit with them. Eventually, they return their attention to you and apologize for taking your time. You thank Parker for sharing and offer to listen whenever you can. While you would like to stay longer and continue your talk, you notice the time. You ask Parker if they would be willing to talk again. Parker agrees, thanking you again for the conversation, and you leave to begin planning potential interventions to assist Parker using the community nursing process.